This topic is Cushing syndrome. Cushing syndrome results from prolonged exposure to excess levels of corticosteroids within the body. Let's first talk about how corticosteroids are naturally released into the bloodstream. We're going to look at two organs specifically, being the pituitary gland and the adrenal gland. Our body is naturally going to need and release corticosteroids when there is a stress response. The pituitary gland is going to release adrenocorticotropic hormone, or ACTH. This hormone is going to make its way to the adrenal gland, which is going to result in the release of a number of corticosteroids. One of the most important corticosteroids that's released is cortisol. And cortisol we can think of as a stress hormone. As cortisol levels build up within the blood, this is going to result in a negative feedback loop. The more cortisol we have, the less release of adrenocorticotropic hormone that we're going to have from the pituitary gland. As the stress response begins to wear off within our bodies, this means that decreased level of adrenocorticotropic hormone is going to lead to decreased levels of cortisol, which will then become normal. With Cushing syndrome, however, we have a prolonged exposure to an excess level of corticosteroids within the body. This can occur from exogenous sources, say if a patient is taking any glucocorticoids or steroid medications, such as prednisone or methylprednisolone, or this can occur from an endogenous source. If the adrenal gland has a tumor or is hypertrophied, this can lead to excess cortisol levels. Or we can have high levels of adrenocorticotropic hormone from a pituitary tumor or from a tumor that's not within the pituitary gland. Again, with high levels of ACTH, that is going to lead to the release of corticosteroids within the body. Clinical features of Cushing syndrome are going to mostly be associated with that increased level of cortisol within the body. However, there are other corticosteroids that can contribute to some of these clinical features, such as aldosterone, which is important for sodium and water reabsorption, as well as androgens, which are important for growth, as well as the development of sexual characteristics. As I said before, cortisol is what we think of as a stress hormone, and this can cause a number of changes within our body. Increased levels of cortisol can lead to anxiety, as well as development of depression. Now, this depression can also be associated with body image, and some of the changes that have occurred within the body are a direct result of this buildup of cortisol. Cardiovascular changes can occur, such as the development of hypertension and cardiac hypertrophy. Cortisol enhances the effects of catecholamines like epinephrine and norepinephrine within the body, and this can lead to vasoconstriction, which increases the pressure within the blood vessels. Additionally, aldosterone will lead to sodium and water reabsorption, which will increase the circulating fluid volume and also contribute to that hypertension. Cortisol affects proteins within the body, so we're going to have changes to the integumentary system as well as the musculoskeletal system. We're going to see thinning of scalp hair as well as the skin, and this thinning of the skin can contribute to the development of abdominal striae and easy bruising. Osteoporosis and muscle wasting can occur due to the presence of that increased cortisol. Increased levels of androgens within the body can affect sexual characteristics. So for females, the development of hirsutism, which is facial hair, as well as the development of acne can occur. Metabolic changes with cortisol are important. The presence of cortisol itself leads to insulin resistance, as well as gluconeogenesis by the liver. Essentially, what this can lead to is the development of hyperglycemia, especially when the client has an increased appetite. Therefore, it's very important that we monitor blood glucose levels in these clients. And lastly, some of the more pronounced features of increased cortisol levels within the body have to do with the deposition of fat. Clients with Cushing syndrome usually develop central or truncal obesity. They can get fat deposition within the face, which creates what looks like a moon face. It's very round. And they can get fat deposition on the back, in between the shoulder blades and at the base of the neck. Treatment for Cushing syndrome is going to focus on removing the source of those excess corticosteroids. So if there is a tumor, whether that's within the pituitary gland, the adrenal gland, or somewhere else within the body, that tumor needs to be treated. If the client is developing Cushing syndrome from exogenous steroids, we need to begin the process of slowly tapering those steroids. Now, we don't want to stop those steroids abruptly, as this can lead to adrenal insufficiency or Addison disease, which is something we'll discuss in the next slide. It's important for these clients to understand that body changes can take months to reverse. Even though we may have begun the process of decreasing those corticosteroids within the body, we still have that buildup of fat and deposition of fat that can take a while to actually get rid of. It's important to monitor blood pressure in these clients as well as administer antihypertensives if the client has developed that hypertension. The nurse should also assess for any skin breakdown due to that breakdown in collagen. And there are a few dietary recommendations that the client should incorporate within their diet, such as high protein intake, which will help build up that muscle again, and daily intake of vitamin D and calcium, which will help increase that lost bone matrix. To wrap up our discussion on Cushing syndrome, let's draw a comparison between Cushing syndrome and Addison disease. The reason we want to draw this comparison is that Cushing syndrome and Addison disease are two sides of the same coin. While Cushing syndrome is that excess or increase in the amount of corticosteroids within the body, Addison disease refers to an insufficient amount of circulating corticosteroids. Addison disease occurs when there is not enough corticosteroids within the body or an insufficiency. So there are some similarities when it comes to the clinical features. However, most of the time we're going to see almost the polar opposite between the two. While Cushing disease is associated with hypertension and cardiac hypertrophy, Addison disease is associated with hypotension and low cardiac output. Cushing syndrome, we're going to see increased appetite and hyperglycemia, whereas with Addison disease, we're going to see a decreased appetite and hypoglycemia. Instead of an increase in the growth of body hair like we would see with Cushing syndrome, with Addison disease, we're going to see decreased axillary and pubic hair, especially in females. We'll talk further about Addison disease in another presentation.